Good morning, everyone. My name is Daniel Chansa, and this is my week four's discussion. It also is in the same line as this week's soap note, same patient. As I begin, this is the ID for my patient is MG, chief of complaint. Patient states I've been having a cough with wheezing and some clear sputum for the past 4 days. As for the HPI, use of old carts, onset, cough began approximately 3 days ago and gradually worsening. Duration, persistent cough lasting for 3 days, presently intermittently. Characteristic, it began as a dry cough at first, now with productive, with clear sputum, and wheezing occurs mostly at night and sometimes in the morning. Aggravating factors, symptoms worsen at night, possibly due to laying down and other environmental triggers such as dust, pollen, or cold air. Relieving factors, patient states tried some over-the-counter cough syrup, didn't work. Symptoms kind of improved a little and continue being persistent. The over-the-counter did suppress the cough and also increasing fluid, but it still hasn't cleared up. The timing, symptoms are pronounced at night and early morning. No recent exposure to sick individuals. And the severity, mild to moderate severity with wheezing, also affecting sleep and normal daily activities. As for the medical history, patient has had hypertension and was diagnosed 5 years ago, asthma, adolescent, and occasional flare-ups. Hyperlipidemia diagnosed 2 years ago, and also had some preventative care, mammogram last 2 years. A pap smear was done 3 years ago with no more findings. Colonoscopy not yet performed, recommended for screening at age 55 of age. Has had no surgeries, no hospitalization. Menstrual cycle last was 6 years ago, postmenopausal, and pregnancy status not pregnant. As we move to the exam findings, patient presents with obvious visible rhinitis and teary eyes. Patient for the general survey is alert, oriented, and cooperative. No acute distress noted. Healthy appearance. Patient is Hispanic and also alert and independent, historian, and reliable. Patient Perla, no oral lesions noticed. Mucous membranes are moist. No erythema with slight edema posterior of the pharynx. With cardiovascular, upon auscultation, apically regular rate and rhythm on the heart. No murmurs, rubs, or gallops upon auscultation. Pulmonary, mild wheezing, auscultated bilateral on expiration. Clear breath sounds on the top of the lungs bilateral. With the abdomen, soft, non-tender, no hepatomegaly, no normal bowel sounds and active and present in all four quadrants. Extremities, no cyanosis, no edema, no clubbing, positive pulses in all extremities. And for the diagnosis, I took asthma exacerbation as my main diagnosis and final diagnosis, and the differential was asthma exacerbation, COPD or chronic obstructive pulmonary disease, acute bronchitis. And my treatment plan for my patient is to have a chest x-ray done to rule out pneumonia or other lung pathologies. Use of incentive spirometer to expand the lungs and also assess the lung function. Also, albuterol for medications 3 times a day as needed. Also consider adding an oral consider adding an inhaler versus steroid to prevent further flare-ups. Also, education to have patient increase water fluid and activity for exercise to help evacuate the sputum that's stale or sitting at the base of the lungs. Also, consider oral prednisone if asthma exacerbation is severe. Also, for the education to conclude in eating healthy fruit, vegetables, and staying away from certain foods that might trigger any coughs, such as cold water or anything in that regard. Also, avoiding allergies, dust, cold environments, and other triggers. And as for the follow-up, patient to return in 1 week or sooner if symptoms worsen. Also to follow up on the chest x-ray and sinus spirometer results. And also to educate family members to look out for triggers that might be life-threatening and to present to the emergency room if needed. Thank you. Have a good day.